Hello and welcome back. In today's lesson, we are going to be diving into our first two categories of psychological disorders for our clinical psychology unit. They are our anxiety disorders and mood disorders, some of the most common psychological disorders in the DSM-5 in our society today. So let's go ahead and take a look first at anxiety disorders. It's important to note that everybody experiences stress and anxiety, and they are very common feelings and emotions to experience. And they can be mental health issues, or we may be looking at a diagnosis of an anxiety disorder. And again, we can go back to those 4 Ds from the last video to talk about why we would need to make a diagnosis. An easy way to think about this difference is to ask yourself the question, what are you afraid of? And maybe you're afraid of heights or open water, dark spaces, spiders, snakes, whatever it may be. We all experience fear on a regular basis. The way we could distinguish between a fear and a phobia, however, is being able to identify that fear, knowing that it passes with time and it's reasonable to the circumstances, or if it goes beyond what is considered a reasonable expectation, if it is distressing enough or disrupting a person's day-to-day life, that's where we might be moving into the territory of a phobia. And that is one of the anxiety disorders we're going to be looking at today. But first I want to talk a little bit about the potential causes of anxiety disorders. Why do anxiety disorders affect some people and not others? We're still learning so much about the brain every single day that's helping us to understand the biological nature of psychological disorders. We know that there are certain neurotransmitters, such as GABA and norepinephrine, that play a role in anxiety. And how much of it we have and how it affects individuals varies from person to person. There are also cognitive factors in relation to how we think about different experiences, and social factors of different events that we've experienced in our life that are all going to have a contribution to the development of anxiety disorders. And typically it's going to be a combination of all 3. A specific phobia, for example, could be the result of biological forces, learned behaviors, and cognitive thought processes that all play a role in the deep and overwhelming fear that a person has to a specific object or concept. And the key distinction between a fear and a phobia is that it does disrupt a person's daily living. Phobias are very common. About 10% of the population will experience a specific phobia at one point or another. Some examples of specific phobias include social phobias, where a person has a fear of performing or being judged in front of others, or agoraphobia, where a person has a fear of public spaces where there is no escape. Other anxiety disorders include panic disorder, which are recurring panic attacks that are often not tied to any particular event. Symptoms include feelings of impending doom, chest pain, dizziness, or fainting. They can last for just a few minutes, but they seem to come on for no apparent reason. Generalized anxiety disorder is like a less intense version, but longer lasting feeling of anxiety. So generalized anxiety disorder still has a feeling of tension and apprehension, but it's not quite as overwhelming as a panic attack, and yet it seems to persist for a longer period of time. Another very common anxiety disorder is obsessive-compulsive disorder, or OCD. And this technically has its own section now in the DSM-5 because of the complexity of the disorder. It is multifaceted in the sense that it has both the obsessive thoughts and the compulsive behaviors that follow. So this is a disorder where a person's obsessive thinking, these unwanted, obtrusive thoughts start to show up in a person's mind that give them a feeling of anxiety. In order to minimize or reduce their anxiety, they feel the need to perform compulsions, doing something multiple times, checking and rechecking that things are done. Ritualistic washing of hands or their body are all examples of compulsions that a person might do to rid themselves of the anxiety-producing thoughts. Treatment options for OCD might include things like medications or different types of therapy, such as exposure therapy or flooding, where a person is exposed to the source of their unwanted or obtrusive thoughts, but they're not allowed to engage in their compulsions. The idea would be to get their anxiety to be very, very high, and then naturally let the anxiety come down further and further without doing the compulsions, so that a person can rewire their cognitive process to realize that they don't need to do the compulsions to make those thoughts or that anxiety go away. Finally, some other types of anxiety include anxiety that is tied to specific events. Sometimes we experience traumatic or stress-inducing events in our lives. Could be anything from a natural disaster, like a flood or a fire, that could cause anxiety to show up in our lives. Sometimes this happens immediately after an event, and that is known as acute stress disorder, where a person feels the effects of anxiety very soon after an event has taken place. Post-traumatic stress disorder is what happens when that anxiety shows up after the fact, maybe a few days, weeks, or months later, that the anxiety occurs or reoccurs as a result of the initial trauma. And again, there are many different causes and many different treatment options for these different anxiety disorders. Each would be as unique as the individuals who are experiencing them. But some therapy options that are available for anxiety disorders could be in the form of anti-anxiety medication, or in the case of OCD or phobias, exposure therapies or systematic desensitization might be effective treatment options. If someone has a phobia of spiders, for example, a process known as systematic desensitization could be used to slowly build up to a person conquering that phobia. The first step might be as simple as thinking about spiders and working on progressive relaxation techniques until that thought no longer produces the anxiety. Then they might build up to looking at pictures of real spiders, maybe eventually holding a spider or touching a spider, until eventually they can interact with spiders without experiencing the anxiety that accompanies that phobia. And finally today, we're going to go ahead and take a look at mood disorders. This is another really common category of psychological disorders that we see in society. There are a couple that we need to take a look at, and some potential causes that we can examine as well. So when we think about mood disorders, we are also looking at different neurotransmitters that could be responsible for both happiness and depression. Serotonin, as we know from neuroscience, is our happiness neurotransmitter. And so antidepressant medications are often SSRIs that are going to prevent that reuptake of serotonin to increase the feelings of serotonin in the brain. Norepinephrine also plays a role in these mood disorders. We sometimes see it in overabundance in individuals experiencing a manic episode, and in lower levels in someone experiencing depression. But mood disorders are characterized by disturbances in a person's mood, or when they are stuck in a prolonged emotional state. They could be moving from one extreme end to the other, or stuck in one prevailing mood for an extended period of time. Again, it's important to recognize that we all feel a wide range of emotions, and that is entirely normal for every single one of us. However, if we find ourselves stuck in a mood or moving quickly between the extremes in our mood, that is where we might see a diagnosis of a mood disorder. The most common mood disorder is, of course, depression. When a person experiences overwhelming sadness, lack of interest in activities, and perhaps feelings of excessive guilt or worthlessness. It's important to note that anybody can feel depressed. It's never a good feeling, and when we do experience it, we need to take care of our mental health. Depression is diagnosed as either clinical depression or major depressive disorder when that depression is long-lasting and goes beyond what would be considered a normal reaction to a life event that could induce sadness and depression. A less common type of mood disorder is known as dysthymia, and this is a less intense but longer lasting type of depression. You can kind of consider it like a feeling of melancholy. It's not quite as intense as depression, But the problem with dysthymia is that it never lets up. A person can experience this feeling for up to 2 years with very little to no relief. It's 2 to 3 times more common in women than in men, and it's very difficult to diagnose. And that's because many people who experience dysthymia will think to themselves, well, I'm not depressed, I don't feel that sad, and so they don't seek out professional help for their dysthymia. And our final category of mood disorders that we'll take a look at today are manic episodes and bipolar disorder. Again, bipolar disorder is in a classification on its own because of its complexity, but it is a mood disorder where a person goes back and forth between both manic episodes and depressive states. A person experiencing a manic episode might experience euphoric moments, feeling extremely active and engaged, but perhaps also easily distracted and sometimes highly irritable. If that is followed by periods of depression that could last for a few days to a few months, that is when it falls under the classification of bipolar disorder, when a person is stuck between these two prevailing moods. There are different types of bipolar disorder, and they will affect individuals differently depending on their diagnosis. But that's where we'll stop for today, looking at our mood and anxiety disorders. In our next video, we'll take a look at personality disorders and somatoform disorders and talk about the symptoms for both. Thank you so much for watching, and as always, remember, be kind to your mind.